Hello, Dr. James Bogash, expert in health and longevity, and in today's video we're going to talk about a not surprising result of a study on prostate cancer, and more specifically about the concept of active surveillance or watchful waiting, which we do with prostate cancer, and there's no reason we shouldn't look at the similar concept for women with breast cancer, but it will probably never happen. Before we go into this, though, make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel. So, the idea is that there are many people that die with breast cancer, or with prostate cancer, not from prostate cancer. But we live in a society where we hear cancer, like somebody comes back and their PSA level's elevated, or we get a biopsy with some abnormal cells, and we're like, just take it out, get rid of it, we don't want to mess with it. Same thing happens with breast tissue. If we find like DCS on mammography, that people are like, there's no concept of, hey, let's keep an eye on this. It's just, let's take off the offending tissue, whether it's the prostate or the breast. But there's this concept of active surveillance or watchful waiting. Some nuances between the two. Usually, active surveillance requires more constant monitoring of both MRI, possibly biopsy, or PSA levels. The interesting thing is that it took a long time to get people to register for these studies to find out if waiting had a disadvantage to taking out the prostate right away or aggressive treatment. And once they finally got enough people to do the studies, they found out that it's a very reasonable approach so long as you meet certain criteria. And that typically is looking at Gleason score, which has a lot to do with, there's different, a little too deep to go into Gleason score, but usually if you have a PSA less than 10, if it's localized, it hasn't spread anywhere else, and your Gleason score is less than or equal to a 6, you're usually going to be put into this, or have the potential to be put in this watchful waiting or active surveillance category. And I firmly believe that cancer is always forming in our body. It's just a balance between our immune system taking care of it and the toxicity we live our lifestyles in creating it. And so if these studies on active surveillance, watchful waiting, are all done on people who don't change their lifestyle. So even without changing the lifestyle, the data is pretty good. So what would happen if we completely overhauled the lifestyle and lived an anti-prostate cancer lifestyle? I'm positive that those numbers for active surveillance would get better as far as outcomes go. So in this particular study, they followed 886 men, average age 66, for about 6.5 years, and they picked people in group 1, and you can look separately for what that category, but it's the same thing where the Gleason score is less than or equal to 6, PSA is less than 10, it's localized. So these people fit into group 1, and so how much did diet play a role in their progression to group 2 or 3 or beyond with worse outcomes? Interestingly enough, out of this study, 21% ended up increasing the grade. So, and then we can look at treatment options from there. So 79% of people over the course of the study didn't have to do anything with their prostate. Again, this is even without a focused attention on lifestyle to clean it up. 6% of the group ended up progressing to high-grade scoring, and those people obviously are going to need some type of treatment. But one of the things that was very clear is that measuring the healthy eating index, or the HEI, has a lot to do with whole foods, so looking at different food components. So let's say you eat legumes or vegetables or cruciferous vegetables, those are going to give you a higher DEI. So higher scores were, those people were less likely to progress from one to higher scores. Interestingly enough, they also looked at the dietary inflammatory index, which is There's some nuances between the two, and that did not show a difference. But the DII looks more at components of the diet rather than whole things. So it may look at like fats and carbohydrates and niacinamide and all of these different things rather than looking at increasing your intake of whole foods, which is, nobody looks at their plate and goes, oh my gosh, this has 23 grams of this and 14 micrograms of that. We should just be looking at eating a healthier diet, and that's what the healthy eating index. So these people who had this index were more likely to just live the rest of their life without having to do anything with this prostate cancer that they happened to find, which is obviously the direction we want. And that's not even looking at specific aspects, which I'm not going to cover in this video, but I've covered them more than enough in the past about things to lower your risk of prostate cancer. Even prostate cancer progressing. So as always, I will post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.